Hello, this is Timothy Dolan, and I'm continuing my series, little chapter summaries on a book that I'm doing on market driven evolution. And this particular chapter is pretty critical because it deals with what amounts to the kickoff of the biotech revolution as it is now standing and is accelerating. It concerns a Supreme Court decision, Diamond versus Chakrabarty. This was a decision rendered in 1980 that determined that novel non human life forms that are created, in essence, in the lab are patentable, meaning that there is forms of life that can be considered property, intellectual property, and in fact, physical property. So let's get on with it and go over certain basics because, again, when we're talking about market driven evolution, we have to understand market dynamics and the origins, as I said, of the legal foundations for the biotech revolution. So we'll start with the concept of, first of all, on the pharma side, what we often refer to as big pharma, but in fact, there are innumerable little boutique research operations that are going on thanks to, again, the genetic revolution and the prospect of coming up with medicines and treatments and such that will yield, in essence, profit. Now, Big Pharma, of course, is at the head of the curve on this for the most part. Although, again, there are a lot of what we can call wildcat prospectors as well, because this really is a gene rush, very much along the lines of the gold rush in the 1840s and 50s in the United States. So let's get into it. Here we have a little chart, a little graph showing the projected profits that are going to be coming out of new pharmaceuticals that are largely developed from molecular biology and genetic science, where they're able to recombine certain genes and create transgenic, in some cases, transgenic products that have effective results for treatments. So the projections are along these lines. And again, Big Pharma is anticipating this expansion of their products. And that's not a bad thing. It is something that, again, because it's market driven, the markets are going to be responding positively to treatments that are going to be affecting overall quality of life. So moving along, and again, getting into really the structure of things, this is what I refer to as a kind of a generic rendering of generic industrial complexes. Now, industrial complexes are just that. They are complex. What we're going to look at are three dimensions, and these are key dimensions. First of all, it is industrial domination of information. They have their own research labs, and in addition to their own research labs, they have government research that they are able to go in, take, refine, and call their own. This happens all the time. So it's something that governments do. It is something, particularly in the United States, there's a large government infrastructure for advanced research, particularly in the medical fields, and to a lesser extent, food science and other areas. But the information dimension, again, should be fairly obvious once you break it down and understand that the public in this arrangement is often sending information. Of course, they send it to government. They also send it as feedback concerning products and preferences, largely done at the behest of the industries themselves, so that they can refine their appeal to the public for their various products. Now, industry also has a very powerful informational back and forth between government and itself. This takes the form of something quite familiar we call lobbying, where they try to prevail on the government and its constituent regulation infrastructure to allow them access and guidance, in fact, in many cases, for what products can get to the market. Now, there's some notorious cases, the Sackler family with the opioid that they developed that ended up known as Oxycontin, which was terribly misused, highly addictive, and they managed to prevail upon key government regulators to deem it safe for use, which of course, as a painkiller, very effective. Its addictive qualities were downplayed and resulted in fairly tragic consequences that we're paying a price for even now. But that's an example of exchange of information. In some cases, it's influence peddling. In some cases, it's simply getting rulings from government agencies as to what can move forward and what can't in terms of clinical trials and the expansion into the marketplace of certain, in this case, medical treatments. We're going to focus here on medical treatments. The public is influenced by information in the form of advertising, so that you can see in numerous channels advertisements for various medicines and treatments that really dominate many media, particularly television media, targeted to often older Americans with health problems that are more likely to be homebound and thus watching a fair amount of TV and being exposed to these kinds of products that may or may not be appropriate. But at least they're being informed about it, at least from the industry. And again, it's in the form of advertising. Moving along, that dimension of information is pretty key. Notice that it tends to advantage the industry. The second dimension concerns resources, and resources in this case is generally money. Of course, the public funds both government, and they fund government in the form of taxes, fees and such, and then they fund the various industries in terms of purchase of products, goods and services from those industries. But what is often missing from this calculation is the fact that the government itself is one of the principal customers for industries. And again, particularly if you look at pharmaceuticals, they are a major purchaser for various medicines on behalf of their constituents, the public, in terms of Medicare, Medicaid, prescription drug plans and such that the government oversees and often underwrites. Now, notice again the flow of resources goes largely away from the public. It trickles back, of course, from government to the public in terms of providing guidance in medicines, informations, and such. But the overall flow is really in the other direction. And it is particularly the case of industry where they benefit both from the resources that they get from the government in terms of subsidies and research projects that take place in research laboratories at the universities and other research institutions that the government helps to fund. And then again, a second revenue stream comes from the public itself in terms of their purchase of these various products that were developed, again, often with a great deal of government assistance. So the point is that we have an industrial complex that, on balance, tends to benefit industries. The third dimension, extremely important, is that of talent, that the flow of talent can run up to government. This is what I call the diamonds in the rough. These are people that are often brought into government service, either through the military or other means, and they're trained. They're trained, and they become expert in various fields with government assistance. That then ends up transforming into their moving on into industry once they've attained a certain level of expertise and credential and certification. They then go to the private sector where their remuneration is much larger and much better than you would get in government. Of course, there are also simply the polished, highly talented folks that, again, are going to move directly into industry. They don't need that intermediary step of training. They get it either through their university education or often they come in as immigrants. And again, the public is ending up sending these the talent into the private sector. And the private sector, again, is a beneficiary. So these are those three dimensions of industrial complexes. It's not confined to the medical industrial complex. There's a food industrial complex. There's, of course, the well-known military industrial complex. And the list can go on. But for our purposes, we're really looking, in this instance, focusing on the pharmaceutical side. Moving along. So we have now, largely we can credit this to the genetic revolution and to the Human Genome Project, which has mapped the human genome to such an extent that we have a much better idea of what treatments are most effective for certain types of people. So we're starting to get into the dawn of what we can call boutique medicine, where there is medicines that are very specific for certain types of people, and medicines that, for example, avoid an allergic reaction or other negative effects, side effects for certain types. This is an ongoing refinement in the pharmaceutical industry. Here we're looking at broad types of biologic medicines led by vaccines. Vaccine is a biologic medicine, something that's produced from the interactions with various antibodies that are developed from living sources that will help immunize one in the event of a viral attack or other microbial pathogens. And the list goes on. There's several other classes of biologic medicines. I won't go through all of them. This is going to be outlined, of course, in the book chapter. So we have, of course, now you have to remember that this data is really coming during the COVID pandemic. So it is dominated by those various pharmaceutical companies that led the way in producing effective vaccines for the COVID-19 virus and its variants. But it's not confined simply to those vaccine makers. We have numerous other, uh, big pharma companies that have developed biologic medicines for treatment. Very often, again, they're often used for um, dealing with reactions, allergic reactions, and other autoimmune responses, either helping or hindering those, depending upon the nature, because there are sometimes autoimmune diseases are a problem in that you have your immune system attacking your own body. So there are several medicines that are used to mitigate those effects. Moving along, here we're shifting into the food and nutrition side of things. And it's an interesting kind of a sidebar, but important. And again, it gets to what's going on in genetic science, where we are becoming, as a whole, and this is globally, a healthier people. I can attest to this based upon a trip that I took to Spain and to North Africa very recently, literally last week, where I was surprised and kind of delighted to see that the restaurants that I went to had numerous smoothies and other fruit drinks that are, quite healthy in terms of their nutritional value. And these are proliferating into areas you wouldn't expect. But there they are. And as a result, we have the potential of developing a whole plant-based food industry, which has a great environmental benefit in that livestock has a very heavy cost on both the land and air in the form of production of greenhouse gases. So this innovation is now manifesting itself in a literal change in what we are eating. It's slowly trending away from the traditional meat diets to an expansion into the plant-based side. Again, by and large, much more healthy and environmentally sustainable. So again, this is a summary of the chapter. Diamond versus Chakrabarty did establish that living organisms could be patented. This revolutionized the biotechnology industry, creating, again, we can call this, by way of analogy, the gene rush, spawning not just big pharma, but a lot of boutique, small-scale companies that are using genomics to develop medicines and other biologic benefits. Diamond versus Chakrabarty did set a legal precedent that patentability is determined by human ingenuity and is not something that is naturally occurring. So we're driving, again, we're driving not in a small way, incremental way, maybe human evolution, but the evolution of a better quality of life, again, through genetic science. Now, it has raised ethical questions around the commodification of life forms. And it is analogous to what had happened when we had a traditional system of what was known as the commons, and the transformation of a commons where the community had a collective responsibility towards the sustainability of the land, to real estate where it is now chopped up and there are individual landholders that often have the determination of what happens on their lands with some nominal regulation by government, but the analogy still holds that we've transformed the commons of nature, of natural remedies, of natural, call them natural foods, to now privatized brands that are patented and held as a brand, even though they are in themselves life forms. So that's in a nutshell this particular chapter dealing with the broad questions of what has spun off from the Diamond versus Chakrabarty decision and the patentability of life, and how that has driven a lot of innovation in the areas of food and medicine production. So with that, look forward to hopefully having the book out soon and people reading it to gain further details on how these concepts are driving ultimately evolution, human evolution, and evolution on the planet, because we are picking winners and losers now. We are favoring certain species over others, and we are doing a great deal of work on unraveling the genetic codes of not just our own species, but of species all over the world. So again, look forward to some feedback on this. My name's Timothy Dolan. Thanks for your time.